Hi, my name is Kunal Parekh. I'm an orthopedic physician assistant here at St. Peter's University Hospital, and I'm here today to talk about joint replacement class and your path to recovery. Your surgeon has recommended joint replacement for you so that you can get back to doing things you love to do. So today we're going to talk about joint replacement, what it means for you before surgery, during surgery, and most importantly, after surgery. Your family and friends play a huge role in your recovery. They are your cheerleaders. Make sure they watch this video with you so they can support you when you get home from surgery. We have a multidisciplinary team here to help coordinate your care. You will be seeing some of our team members through this video series, including physical therapy, anesthesia, our nurse manager, and our care coordination nurse. My role as an orthopedic PA is to keep in touch with your surgeon. You will be hearing from me within a week before your surgery. You will receive a joint replacement printout along with the Hibiclin soap when you see pre-admission testing. Please review this packet and note down your questions. You will hear from me within a week before surgery, and you can ask me any questions you have at that time. You will see me when you come up to the surgical unit. I will be helping you with your pain. I will be helping you coordinate care with physical therapy. We expect you to be here overnight, so you will see me the next day as well. I will be helping you with your discharge. I will be helping with the post-op dressing and helping you get home. We have physical and occupational therapy that will see you until you meet your goals for discharge. We also have the nurses that will get you out of bed. On the day of discharge, you will get written instructions from the nurse. So this is when you will ask any questions you have about your discharge. You will also meet with the visiting nurse agency that will be coming out to your house for home physical therapy. But remember, you will need support from your family for the first few days when you get home. When you're home, remember you need to get up and walk every hour. Remember to elevate your leg, ice it, and also remember, take pain medications as needed. When you're discharged, remember to follow up with your surgeon and call me with any questions you have, and remember you can also call your surgeon's office. Thank you for choosing St. Peter's for your joint replacement. We wish you success.